We are going to discuss about GOUT, GOUT, GOUT. So, what is GOUT? GOUT is nothing but increase in the uric acid level. Increase in the uric acid crystals in joints. Simply we call it as GOUT. So, in this condition, there is increase in uric acid. So, we are going to discuss about the source of uric acid. Source of uric acid. From the general biochemistry, we can understand that purine converts to xanthine in the presence of xanthine oxidase. In the presence of xanthine oxidase, it gets converts to uric acid, and this uric acid is the one which gets deposit in joints, and upon deposition it causes inflammation, and we know what happens during the inflammation. There is a chemotactic attraction, and which will upon gives to pain, and this gout occurs mainly in the first tarsal bone, or we can simply say that big toe. This uric acid accumulation mainly occurs in the big toe. And from now we are going to discuss about the drugs for gout. The drugs are divided into for acute gout and for chronic gout. And here please remember that when we are treating with acute gout, the drug should be given only to acute gout. It should not be given to the chronic gout. And when we are treating the chronic gout, the drugs which are used in chronic gout should not be used in the acute gout. They too have the both different types of drugs. Okay, so for treating of acute gout, we prescribe NSAIDs, non-steroidal anti-inflammatory drugs. What this drugs does? Simply, these drugs decrease the inflammation. For example, we take NSAID, for example, diclofenac, endomethacin. There is one contraindication here, is that in gout we have to not use aspirin. Aspirin is also an NSAIDs, but it is contraindicated because we have found that aspirin increases the level of uric acid. Okay, and after NSAIDs we can give steroids. Steroids. For this steroids, same, the steroids also decrease the inflammation. And please remember that steroids should be given within the normal limits, because we know that steroids within the normal limit, it act as anti-inflammatory. But greater than the normal limit, it acts as immunosuppressant. So when the patient is taking steroid, he have to not stop continuously, but he have to stop with tapering ends. What means tapering ends? Suppose we are prescribing 4 times per day, then we have to decrease this count for 3 times a day, 2 times a day, like this. This is called tapering. This whole thing was about the acute gout. Now let's go about for the chronic gout. So what is the mechanism action for treating the chronic gout? Here we have discussed that xanthine, in the presence of xanthine oxidase, converts to uric acid. The first thing is we have to block this xanthine oxidase. If you block this xanthine oxidase, then it will be not converted into uric acid, so the uric acid level will be low. This is the first. Second is that in the nephron we have URAT receptor. The function of URAT receptor is that it transports the uric acid back into the body. So what we have to do, we have to block this URAT receptor. This is the second. Next, third. In birds, what happens is that this uric acid converts into allantoin. This is more harmful, this is less harmful by the presence of enzyme urease. So what we have to done, with the help of recombinant DNA technology, we have made uricase like drugs for humans. Uricase like drugs for human. Okay, so let's go somewhat deep about these drugs. Okay, first one is the xanthine oxide inhibitor. Xanthine oxide inhibitor, and the best example is allopurinol. This is the main drug. Now second drug is uricosuric drugs. The example is sulfapyrazine and propicinide. First we will write the drug names and the classification, then we will say how these drugs will act. Next, third one is the urease drug, recombinant urease drug. We have told now. Yes, the example are rasburicase and pegloticase. Okay, now let's go some deeper. We have discussed that we have to inhibit xanthine oxidase here. So what is the drug? Allopurinol will inhibit the xanthine oxidase, so uric acid level will be decreased. Second drug was which blocks the URAT receptor, and these drugs are called uricosuric drugs. See, this is the uricosuric drug. We have written this uricosuric drug. What do? They inhibit URAT receptor. So what is the problem in this condition is that, see, we have inhibiting the URAT receptor, so the uric acid will not be absorbed, but this uric acid will get deposited and it may cause stones. This is the main problem in this. And the third drug is pleglotidyl tribosuricase. We told that this drugs convert the uric acid. This converts the uric acid into allantoin. So this was about the gout. See, gout, increase in uric acid crystal in the joint, big toe, source of uric acid, purine. See, this is the main thing, purine get converted to xanthine get to uric acid, and it causes pain. The enzyme is a xanthine oxidase. Two types of gout, acute and the chronic. For acute we give NSAIDs and steroids have to be done with tapering ends. For chronic gout, three mechanisms. So as I told that treatment are separate. Don't give the drugs of chronic to acute and acute to chronic. It may lead to adverse effect. This was about the gout.